Why do you get UTIs? Understanding bacterial causes. Imagine a tiny invasion happening inside your body that can cause discomfort and urgency. Urinary tract infections occur when bacteria enter and multiply in parts of your urinary system, which includes the tube that carries urine out of your body, the bladder, the tubes connecting the kidneys to the bladder, and the kidneys themselves. The main cause of these infections is bacteria, and understanding how they get there can help you prevent them. The most common bacteria responsible is Escherichia coli, often called E. coli. This bacteria normally lives harmlessly in your intestines, helping with digestion. But certain strains, known as uropathogenic E. coli, have special tools that let them stick to and invade the lining of your urinary tract. These tools include tiny hair-like structures called fimbriae or pili, which act like hooks, helping the bacteria cling to the walls of your bladder. They also produce toxins that can damage tissue and have ways to avoid your immune system, making it easier for them to cause infection. Most of the time, bacteria from your gut or around your genital area can find their way into your urethra, especially if you wipe from back to front after using the bathroom or during sexual activity. These behaviors can transfer bacteria from the anus to the urethra, which is the opening where urine exits your body. Once bacteria reach the bladder, they can multiply rapidly, forming protective communities called biofilms that shield them from your immune defenses and antibiotics. Other bacteria can also cause UTIs. For example, Staphylococcus saprophyticus is a common cause in young women, especially during or after sexual activity. Klebsiella, Proteus mirabilis, and enterococci are more often involved in infections in older adults or in complicated cases. Proteus mirabilis is notable because it produces an enzyme called urease, which can raise the pH of urine and lead to the formation of stones in the urinary tract, making infections harder to treat. Once bacteria are inside the bladder, they can hide inside the cells lining the bladder wall, creating reservoirs that can cause recurring infections even after treatment. They can also form biofilms, which are slimy layers that protect bacteria from antibiotics and immune responses, making infections stubborn and difficult to clear. Your body's natural defenses usually keep bacteria out of your urinary system. Urine flow helps flush out bacteria, and your immune system produces antimicrobial peptides that attack invaders. However, if these defenses are weakened or overwhelmed by dehydration, hormonal changes, or other health issues, bacteria can take hold and cause infection. Understanding these bacterial causes is important because recurrent or chronic UTIs can lead to ongoing inflammation and damage to your bladder lining. While UTIs themselves do not directly cause bladder cancer, persistent inflammation over time can affect bladder health. Protecting your bladder involves good hygiene, staying well hydrated, and seeking prompt medical care if you experience symptoms like burning, frequent urination, or pain. In summary, bacteria, especially uropathogenic Escherichia coli, are the main culprits behind urinary tract infections. They originate from the gut and genital area, cling to the bladder lining using specialized structures, and multiply, sometimes evading your immune system. Knowing how these bacteria cause UTIs helps you take steps to prevent infection and maintain healthy bladder function. Always consult a healthcare professional for personalized advice and treatment options.